misconceptions of mental health is that a lot of people associate it with bipolar disorder, schizophrenia, illnesses with names, but there's people who suffer because of illnesses or physical, or they just suffer. So,
suffering.
I'm actually really curious about your situation. Is that you talk about the family support? I mean, that's a support system always helps, of course, but what kind of support system are we talking about? Are we talking about do you have children? Do you have
No, I have no children, which in one way I was upset about because I thought, well, now I can never have them. But then in another way, I was glad I didn't have to sit them down and tell them. So it's sort of a catch-22. But my mom is sitting over there in the corner, and my mom is a breast cancer survivor as well. And I actually found my breast cancer because of my mother's. I was 35. It runs in the family, but I was 35. I never had a mammogram. So my mother got sick, and then I went and got tested. But the support, and I'm sorry, just to answer your question, mainly came from friends and family. I have a wonderful roommate who's lived with me for 13 years, and he moved up to New York and took care of me through all of my chemotherapy, and people did come together. But I was very fortunate to have that. And Sloan Kettering, I went to Sloan, and I was lucky because they do have a wonderful system within Sloan, but not many hospitals.
The reason they have a wonderful system is even I did a little experiment. We took a bill for the same code and gave it to one doctor at Sloan. He got about $250. And we took the same bill through our hospital. We got $25. So
yeah, I mean, there was
what is that? Can you explain what that means?
So
actually,
doctor.
Did you see the story about MD Anderson in the Times? I sent it to you last week. Certain hospitals
negotiate a preferential rate
because they're not only are the doctors getting paid, but they're getting like bonuses for research and all sorts of.
Different places do it different ways.
Correct.
Sloan, for instance, gives their docs 37% of what they collect. And Sloan negotiates with payers favorable rates, which in this one example is 10 times what the non-negotiated rate is. I don't do it for a living, so I take all payers. I'm the only guy who takes a merit choice, which is why I had to admit this woman, and then I could transfer her, which was a way, sort of a backdoor way. And Sloan will get a much higher rate from a merit choice than lots of physicians do.
So are you saying this is a good thing or a bad thing?
Well, I actually wanted to tie it into your Haiti experience, that's a clean slate, a blank slate, and you could actually have a huge impact with relatively little dollars if it's spent on actually delivering healthcare, which for the most part we don't do. All the dollars that go into your insurance premium are marketing and liability and all things that really don't deliver healthcare. So the point I wanted to make is that there is a lot of money in the pool right now. It doesn't have to be. It's not really that difficult to reallocate it in a productive way. It doesn't have to be 1,200-page document.
So starting with a clean slate, are you saying creating a healthcare infrastructure in a country that, without having all of this baggage around it, like
it costs fractions of what we're spending here. It doesn't cost $250. It costs closer to the $25. So we do it at a huge loss, which is why I'm vilified at my institution. But I have some other values. Unfortunately, it does come close to that $250 with all the extra baggage.